Today, our podcast is on adult female hormonal induced acne. This is an important topic that we typically understand goes hand in hand with teenagers. So, why are so many adult women seeing acne breakouts? Is it true that women are more prone to adult acne than men? And what can be done for adult acne? Beautify.com went to an expert, Dr. Rebecca Baxt, board-certified dermatologist and medical director of Baxt Cosmetical, located in Paramus, New Jersey. Baxt Cosmetical is a premier medical and cosmetic dermatology practice that has been serving patients for more than 65 years. The practice has the distinction of being a family business as it was started by her parents. Her father is a plastic surgeon and her mother a dermatologist. They had a vision to provide medical and cosmetic plastic surgery and dermatology all in one practice. Dr. Rebecca Baxt joined the practice in 2000 and continues the family tradition of providing outstanding care and service to her patients. I'm pleased to welcome Dr. Baxt to Beautify.com's podcast on female adult acne. Welcome, Dr. Baxt.
Thank you so much for that lovely introduction.
You're welcome. Well, I thought I would start with exploring what is a board-certified dermatologist. Can you explain to our audience exactly what your specialty treats?
Absolutely. Board-certified dermatologists treat all diseases of the skin, hair, and nails in both adults and children. And we have completed college, university, typically that's 4 years, then 4 years of medical school, then 1 year of an internship, could be in pediatrics, could be in internal medicine. That's a bit variable. And then at least a 3-year dermatology residency with, at the end of that, a board exam, which we need to retake every 10 years to remain certified. So we do a lot of training in sort of general medicine through medical school and internship. And then we specialize in dermatology for 3 full years. Which is skin, hair, and nails.
Yes, I understand. That's important that our audience understands that you are actually the skin medical expert. So that led us to want to speak to you about acne. We know it's a very common concern, but many people just believe it's for teenagers. Yet our topic today is on adult female acne. Can you explain the difference and how it's induced and what age ranges you typically see in women?
Absolutely. While it is true that almost 90% of teenagers do suffer from one type of acne or another, and that is sort of considered teenage acne, it is unfortunate that women are extremely commonly afflicted with acne. Almost sometimes out of the blue, they've been fine as a teenager and then boom, they enter their 20s or 30s and they feel like they're a teenager because, as you said, many people feel that acne is a teenage disease, and it isn't. Acne affects teenagers and adults. In fact, it even affects babies. There's infantile acne, baby acne. But acne really has multiple factors that cause it. And those are sort of the same across all people, but there's different factors that come into play for adults in certain ways. But, there's a bacterial overgrowth, there's clogged pores, there's overactive oil production, and then there's hormones. And the hormones is really what comes into the major forefront for adult female acne. Women have hormonal fluctuations on a monthly basis, and there are just some people who are more sensitive to that, and the hormonal fluctuations can affect them with adult female acne, which typically has a different distribution and presentation than teenage acne. Teenage acne tends to be, not 100% of the time, but often clogged pores, blackheads, whiteheads, pustules, often in the T-zone of the face, the center of the face. Adult female acne is classically cystic, which are red, firm, hard bumps. And it's classically on the cheeks and the jawline, and oftentimes even down onto the neck. It can be around the mouth, but it doesn't go as much to the upper face. So it's a slightly different type of acne, and it's treated differently, and it's very common in women. We see that We see this type of acne starting in sort of the later teenage years. We see it 20s, 30s, 40s, 50s, 60s. On rare occasion, I'll see it in somebody in their 70s, but typically by then it's sort of gone and burnt out. But I'd say very common 20s, 30s, 40s, 50s.
Wow, that's fascinating. So is it difficult to treat? Is it a different protocol than teenage acne?
It's a very different protocol than teenage acne. When it's red, firm, hard bumps, that type of acne really needs to be treated with internal medication. There's only so much that topical medication can do for that. So typically we will go to oral antibiotics, birth control pills, spironolactone, which is a blood pressure medication that's used off label that works well for adult female acne, Accutane, generic name isotretinoin, which can work for, all different types of acne. We also have lasers and lights that can help us. And there actually is a new hormonal cream that was FDA approved this year called Winlevi that is specifically for hormonal acne. It's actually approved for men and women, but this is definitely a niche for it, the sort of hormonally induced acne. So we do have a lot of options in terms of creams for all different types of acne. We have things that kill bacteria, things that unclog pores. But when you get those red, firm, hard bumps, there's really nothing like a pill to help that get better more quickly.
So it sounds like it's a pretty much an individual diagnosis process. Can the patient appears and you examine their skins? How do you know what's an appropriate treatment for women?
Well, exactly. The patient will appear in the office for a consultation. Typically, they've been frustrated for a long time, and they honestly oftentimes don't know that what it is and what can be done about it. They think it's, clogged pores, and they're treating it with all these over-the-counter things, which are absolutely great for acne. Benzoyl peroxide, salicylic acid. They're on anti-aging programs. A lot of these women, they're using retinoids and vitamin C and trying to do all these things for their skin and moisturizing. And it's just not going to, that stuff is not going to fix this type of adult female hormonally induced acne. So typically by the time I see the patient, they've been suffering for many years by the time they find a dermatologist. And I would love for patients to understand that this is a treatable, fixable problem. We may not be able to cure it, but I can always get it under control one way or another, as can many other board certified dermatologists do that for patients. But it's not something that people should be suffering silently with and trying to solve on their own, because you need a board certified dermatologist really to help you with this. It's not the over-the-counter stuff, and the stuff, things from the internet consultations don't typically work well for adult female cystic acne, because it requires more counseling and an understanding of the root causes and going into detail about the different options and figuring out which option works best for that particular patient. There are some patients who cannot take birth control pills for various reasons, or they don't want to take birth control pills for various reasons. There's other people, I'd like to put them on spironolactone, but they are prone to lightheadedness. Well, that's not a good situation if you're going to be on spironolactone, because it's a medication that lowers your blood pressure. So, there are people who want to take Accutane, don't want to take Accutane. There's lots of things to consider. It requires really a discussion between the doctor and the patient.
Yeah, it seems very complex and variable. Do you think just adult women suffering with this are just embarrassed? Why don't they seek treatment? I was talking to someone recently, and she has what looks like the condition, but she covers it up with a lot of makeup.
Sometimes I find that people are afraid of the word acne. They're embarrassed to admit that they have acne. They feel that is somehow, their fault, something that they're doing, that it's bad. And I think honestly, they don't understand what it is and that it's treatable. So that's why I think it's really important to get the word out that, adult female acne is extremely common and it is extremely treatable. And so no woman should have to suffer like that. It can be painful, to be perfectly honest, painful red cysts. If you just have a couple of clogged pores, that's much easier to fix. That's much easier to fix with over the counter and some creams. But when it's that classic adult female acne with the red hard cysts that will often come and go on some type of a monthly cycle, and it's hormonally mediated, that's when you really sort of need to start talking about more serious medications and options. And like I said, in our office, we do have some lasers and lights because there are people who can't tolerate any of those pills. And so I will occasionally do smooth beam laser for patients like this, which is a very old fashioned laser, but works well for cystic acne. I will sometimes do photodynamic therapy, which is not FDA approved for acne, but works well for angry red acne. So those are two alternative things that I will do for patients who cannot tolerate pills. We also will do injections. So if you inject those red painful cysts with a little low dose cortisone, it makes them shrink down much faster and relieves the discomfort and makes the breakout go away. But back to the original part of your question, I think people, number one, don't really understand what it is. I think they don't know that they can get it fixed with a dermatologist. Lots of people don't have health insurance and people are embarrassed
Yeah,
by it. So I
that
think it's a
makes
combination of
sense.
factors.
Yeah. Well, it's good to know that there's just a vast range of options for women, and we want to take the stigma and embarrassment away, which leads me
Exactly.
to another question that if it isn't treated, does it get worse? And what about acne scars?
So adult female acne will sort of wax and wane on its own schedule, oftentimes having to do with hormones. Stress will make it worse. Stress makes pretty much all skin conditions worse. Again, when you get stressed out, your body's hormones change, and so it can aggravate the acne. Sometimes there's dietary things that can play a role. I usually recommend that people eat a healthy diet. Don't eat too much processed foods. Don't eat a lot of high sugar items. It's hard for me to say, oh, not sure if you should avoid gluten or dairy. I think that's very patient specific, but there are people where sometimes they are very run down and they're eating very poorly and they're drinking a lot of alcohol. And while it's not going to cause it, it's going to make it worse. So those are some things to sort of just think about. In terms of the scarring, which you were asking me about, when it's red, cystic, hard bumps, they are definitely at risk of scarring. But there's some different types of scarring that can happen. When a bump goes away, it will often leave a red mark. To me, the red mark, I don't call that a scar. I call that a red mark. And the red mark is temporary. The red mark is going to eventually go away on its own. However, when it's a cyst and you get a red mark, that shows that that spot is at risk of a permanent indented acne scar with atrophy, where the skin could potentially indent. Now, just because you have a red mark does not mean that you're going to get an indent, but when you had a red cyst, there is a possibility of getting an indentation from it later. And so that is why I like to treat these patients very aggressively to prevent scarring.
Mhm.
So if someone has red marks, there's lots of ways to treat them. Number one, they're going to go away on their own. However, I will often recommend one or two pulse dye laser treatments. We have the V-Beam as the brand name, but there's other brands of pulse dye laser or a KTP laser or intense pulse light. Anything that works to reduce redness will help reduce those red marks. But that said, like I told you, the red marks might go away they will go away on their own. It can just take many months. Then sometimes the red marks turn to brown marks. The brown marks are also temporary, but the brown marks we can get rid of with creams, tretinoin, retin-A creams, azelaic acid creams, glycolic acid creams. Sun avoidance is really important because if you put those red marks or brown marks in the sun, they're going to become darker. So an oil-free sunscreen and reapplication of that and sun avoidance is really important. The brown marks we also can treat with chemical peels, easy, quick to do, can help fade those brown marks faster, as well as multiple different laser treatments can help with the brown marks. When it becomes much trickier is when the scars are indented. And once you have indented scars, those really are permanent. And so that's where you really end up doing more of a deeper laser resurfacing. One of the brand name lasers that we like to use is the Fraxel laser. There are other lasers that are effective as well. So we would do laser resurfacing. And then I am a big fan of using fillers for the indentations.
Mhm.
And I do fillers for acne scars all the time. Hyaluronic acid fillers, the type of thing that is FDA approved for injections into lips and cheeks and lines and wrinkles that you see advertised. I use them for acne scars all the time, and they can help plump up the scar so that it is not so indented. And the hyaluronic acid stimulates collagen to grow. So that's the trouble when you have an indented scar, right? It's sort of the collagen has gotten bound down and decreased. And so when you put the filler in there, it helps plump it up and stimulates the collagen to grow. The laser also stimulates collagen to grow. So it's usually a combination of lasers and fillers, but I would really much prefer to treat the patient early on and prevent that scarring, because once you have those indented scars, it's a lot of time and effort to make them better. I absolutely can make them better, but I much prefer to prevent them from happening.
Right.
Obviously, sometimes people get to me, it's too late, they're already scarred. And so we do have to go down that path of scarring. But the good news is we absolutely have effective treatments for scars. When people say scars, sometimes they're talking about the red marks, the brown marks. So I just like to delineate that the red marks and the brown marks are post-inflammatory and temporary. We can get rid of them in many different ways, but the scars that we worry about more are the indented ones. And those are the ones that we have to treat more aggressively with lasers and fillers. So that is a lot of information all at once, but
well,
that's sort of the sum of it.
Yeah, well, it's good to know that no matter where you are in the spectrum of your acne, getting it diagnosed and then having it treated appropriately and then having a maintenance plan is essential. So Dr. Baxt, we touched briefly on makeup and triggers, food. Can you give us, our audience, a little more information on what you recommend?
I definitely recommend oil-free products when you're acne prone. So you have to read the labels. Typically on the bottle or the box, it will say oil-free, or it will say non-comedogenic, which means that it doesn't cause clogged pores, or it will say won't clog pores. So it's one of those three things. Sometimes it will say all three. That's great. So it's non-comedogenic, won't clog pores, oil-free. So you do have to actually read the labels, because a lot of things sneak oil in there, and oil can help clog the pores and make the whole situation worse. So I recommend oil-free makeup, oil-free moisturizers. Once in a while, somebody is dousing their face with oil and it is making it worse. Now, it can be tricky if you're prone to dry skin and you also have tough acne. So we have to be careful. And that's where sometimes you need sort of professional advice. But I would just say gentle cleanser, no picking. Scrubbing it, you cannot scrub this away. Picking it and prodding at it and scrubbing it is just going to make it worse. So mild cleanser, oil-free products, and makeup is 100% okay. Makeup is not causing adult female acne. I just would encourage people to wear oil-free makeup of whatever variety they prefer. And it's absolutely fine to cover it while you're waiting for it to get under control.
Well, that makes a lot of sense, especially the no picking and rubbing and scrubbing. I think all women can relate to that. Thank you, Dr. Baxt, for that very informative podcast on acne. I'm sure our audience learned a lot. And if they'd like to reach you, they can phone your office at 201-265-1300. Or if you'd like to learn more about the services Dr. Baxt provides, go to cosmetical.com.